It is the possibility of that new variant, which is why everyone is so concerned. Also, let's remember, if there are so many new cases in any country as are happening in China right now, there is the possibility for mutation. So the variant doesn't have to be there today. The variant could come tomorrow in case there are new mutations. That's something to keep an eye on. Now, countries around the world are already bracing for an impact. Several countries have announced that travelers from China will have to show negative RT-PCR tests. India is one of these countries. Then you have Morocco, which has actually banned Chinese flights altogether. China is not taking these measures well. Beijing has said it will slap countermeasures on countries who are testing Chinese passengers or asking them for negative RT-PCR. Now, what gives? How can China possibly tell another country what it can and what it cannot do to protect its own, especially because China has just spent 2.5 to 3 years cracking down on all movement from the rest of the world because of its zero COVID policy. So, I think a certain fairness has to be there. That's not exactly the way things work. The truth is, the world cannot afford another wave. The pandemic has already cost us too much, and it's been ongoing for way too long. Let's just recap in case you've forgotten what we've been through.
The year is 2019. The place, Wuhan. People are suddenly falling sick. There is a mysterious virus, one that the world knows nothing about, just that the symptoms are flu-like and it is deadly. Before we know it, the virus jumps border. A person from Thailand tests positive. The chain reaction catches more countries and victims off guard. On the 20th of January, South Korea confirms its first case. The next day, Taiwan and Hong Kong. On the 22nd of January, it's Macau. On the 30th of January, India confirms its first case. The same day, the World Health Organization declares that the outbreak is a public health emergency of international concern.
I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus.
PHEIC. Not many knew what that meant. They understood it through the horror stories that followed, like the virus hit Diamond Princess cruise ship, whose passengers were stranded off the coast of Japan for 2 weeks. There were 3,711 people on board. 712 of them became infected. On the 11th of March 2020, the WHO declares the coronavirus a pandemic.
We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
It's too little, too late. By now, cases have been reported in most countries. Many have declared nationwide lockdowns. The next day, India records its first COVID death. By the 13th of March, 5,000 people die of the virus. What follows are border closures, collapse of healthcare, economy, supply chains, and mental health. 66 million people have died of COVID-19 so far. That's more than the entire population of France or Italy, Tanzania, South Africa, or South Korea. 665 million people have been infected with the virus. That's almost double the population of America. Can the world afford a repeat? Like it or not, China is out there trying to infect the world. COVID-19 cases have surged across China. There is a new variant, but China is not sharing numbers or information. Passengers traveling from China are testing positive. Half of the passengers in 2 flights from China tested positive in Milan, which was also the first European city to fall during the first wave. Is history repeating itself? And should the world be worried?
So what should the rest of the world do to avoid a repeat of all of that? Well, let's just ask Dr. Amita Gupta. She is the Chief of the Division of Infectious Disease at the Johns Hopkins School of Medicine. Dr. Gupta, Joining us right now from the United States. Thank you so much for being with us. Welcome to the show. Wanted to get your sense of what is happening in China. How bad is it there? Because the data is not clearly coming out, and the WHO itself says we're not sure about the data. No one seems to know what is the situation there. How bad is it? Is it the old variant? Is it a new variant? How many people are dying? Nothing seems to be very clear.
Yeah, so great question, Vikram. And thank you for having me again. It's a pleasure to be here. You know, I wish I could say I have the numbers, right? I think part of the challenge is that we really don't have transparency around the caseload, whether it be the hospitalizations, the deaths that are occurring. What we are sort of fairly certain of is that there's a significant underestimation that's occurring between what China's reporting officially to the global sort of media and WHO and others, and what's being seen with images that are, you know, being shared on social media and coming out from various forums where photographs of hospitals show that, you know, right from the emergency rooms to the wards, they're full of patients. They've also shown crematoria really working around the clock, as well as a body bag. So the numbers that are being reported officially, you know, anywhere from 5 to 9 deaths, you know, over the past week are far, far below what we actually think is going on currently. What we do also know is that the variants, because just recently on January 3rd, the China CDC shared their sequence data from the first 2,000 genomes and found that these are all Omicron subvariants, BA5 and BF7. So we don't think that there's new variants currently circulating, because that's been a concern.
Now, that's an aspect that I want to talk to you about, and talk to you about it in some detail, because let's just do some scenario mapping. Scenario one, as I've been saying, China's not had that much herd immunity, not had too much COVID because of zero COVID. You're suddenly opening up, and there's bound to be a surge in COVID cases, and therefore there will be people coming to hospitals. There will be a large number of deaths, and almost certainly way more than what China is saying. But the rest of the world doesn't necessarily need to panic, because, as you said, this is still Omicron. These are still old variants. The rest of the world has been exposed to them. There is some immunity to them. So therefore, don't panic, look at it, have concern, but relax. Don't panic right now. When you panic is a potential new variant that escapes immunity, a situation that Dr. Lee was just now scaring us with. Of these two possible scenarios, which of them is looking more likely to you?
Yeah, so I think currently the current scenario based on the available data is that it's Omicron subvariants which are circulating elsewhere. And we know these variants are more transmissible and have some immune evasion because not all the current vaccine products have this Omicron variants in them, right? But we know that hybrid immunity is far stronger in much of the world, as you just mentioned. So I would say that for the time being, where there's no need to panic, but what the concern is that with such a huge surge of infections, which we're anticipating is occurring, there's always the risk of new variants emerging, right? We see how quickly that happens. Within days to weeks, you can get a new variant, and that can quickly displace the current scenario. But we're not at that point yet, that's for sure.
So I'm just trying to understand the last point you made, and it's an important point. You're saying that if it is the same variant, as seems to be the situation right now, then that's okay. But if 700 million Chinese or 800 million Chinese get COVID, so many more cases, so much more of the virus circulating, the probability or the possibility of a fresh mutation becomes a lot more likely. And that's when you can have something like Delta, which emerged last year. And that is something that is the worrying scenario for the rest of the world.
Yeah, that's what I am saying. I mean, I think that we know the virus can mutate. And the question is, will it mutate into a more concerning form? That's possible. But right now, Omicron and its subvariants have dominated for the last several months. And so, you know, past year plus, right? So we haven't had, despite a lot of infection occurring in waves, while there have been variants that have been generated, we haven't yet gone beyond Omicron. But I agree, with such a large population, so many infections, it just gives the virus the chance to mutate.
So your advice to people, therefore, in 2023 for now, what would that advice be? Can I keep going to watch my sports matches? Can I keep going to restaurants? Can I party? Should I wear a mask at the metro? Should I wear it on public transport? Can I lead my life? It's January 2023. Can I lead my life?
Yeah, well, already people are really. I think everyone's fatigued of COVID, but it's not unreasonable when you do have local surges, when you're in crowded scenarios, to wear a mask. So, like, for example, I still wear a mask in the hospital. I also wear a mask when I'm in a crowded metro or, in a small space which doesn't have great circulation. We are now living with COVID, and we are each calculating what personal risk do we have. Now, if I was someone who's immunocompromised or was on cancer chemotherapy or had, some other disease where I didn't have a normal immune system, I absolutely would be far more careful. I would be wearing my mask pretty much all the time, because even with vaccination, I'm not fully protected and I can get really sick. So each of us is making an individual risk calculation. And I think if you're older, 80 or older, again, you want to be far more careful than if you're a younger person without any illnesses.
So that brings us back to vaccinations and boosters. Now, here in India right now, there's a debate taking place on whether you should get a second booster or not. Actually, first booster is a no-brainer. Everyone should get that first booster, what we call a precaution shot, if they haven't. And here in India, there are a large number of people who haven't taken that precaution shot, and they should. But what is your view on a second booster? Should everyone take a second booster now?
Yeah, so I think that it certainly, because of the waning immunity. So if you have not had either natural infection or at least 6 months since your last vaccine, and there's an increased uptick of cases, that's a time to absolutely get an additional booster. And I will say that in several scenarios around the world, we are advocating an additional booster, a fourth booster, just because of this idea of waning immunity and these ongoing surges that we're seeing.
All right, Dr. Gupta, thank you so much for joining us. 8th of January, just 2 days away. If countries want to hold their shield up, they need to do it now. If countries want to protect their own from whatever is happening and the risk of a new COVID variant, they need to take steps. But I think what we are just hearing from the scientists is there's no reason to panic, not just yet. Take precautions, but don't panic.